Hey, Margie here. Are you ready to delve into estrogen and other bone health issues with a functional gynecologist? Well, if the answer is yes, you are in for a real treat because our special guest today is Dr. Tabatha Barber. And Dr. Tabatha has devoted her life to giving women a voice and a choice when it comes to their health and well-being. As a young girl, she struggled with self-esteem and identity issues and survived the ridicule and stigma of becoming a teenage mother. As she shared in her first published book, titled From White Trash to White Coat, The Birth of Catherine's Purpose, those events led Dr. Tabatha to find her purpose in life. With perseverance and grace, she was able to redirect her path and became a successful physician. Dr. Tabatha is double board certified in obstetrics and gynecology and is a certified menopause practitioner. She also completed training through the Cleveland Clinic's Institute for Functional Medicine and the American Academy of Anti-Aging Medicine. She cares for women one-on-one in her clinic as a functional gynecologist and is the creator and host of the Functional Gynecologist Podcast, where she shares her wisdom and knowledge with women everywhere to reclaim their health. She is also a keynote speaker, clinical instructor, mentor, medical director, wife, mom, and grandma. By incorporating functional medicine into her women's health practice, she is able to provide women with the tools they need to optimize their health and well-being. During today's talk, we delve into bone health from the eyes of a functional gynecologist. We talk about the role of estrogen, what estrogen deficiency looks like, important testing Dr. Tabatha uses, and what she has found to work for women going through menopause and beyond. Stay tuned because there is so much to learn from Dr. Tabatha. Welcome, Dr. Tabatha. I can't tell you how happy I am to have you here. I had so much fun being on your podcast, and I just love who you are, what you do, and I think you're going to bring so much to this community. So thank you so much for being here.
Thanks for having me. I'm super excited because we had a great conversation on my podcast, and I just love for that to continue. I think there's so much information women need to know, right?
Absolutely. So two things. Even before we go into what you do, let's go into your background, how you became the functional gynecologist, because your story, when people hear your story, and to me, when I heard it, it's so inspiring, and it really says who you are and why you're so dedicated and passionate about the work you do. So let's start with your story, because I think it's very enlightening for everything.
Thank you. Yeah, I mean, that's why I share it, because I want to inspire other women. I just think we can learn so much from each other's stories, right? And so I was a wild child. I had no guidance growing up. I was, lived in detention. I was pretty much a bad kid. I ended up pregnant in 11th grade. I got married. I dropped out of high school, the whole bit. And that delivery was very eye-opening for me, my whole pregnancy and delivery, because I was a teenager. I was on Medicaid. And so I was treated as a stereotypical poor white girl. And so I didn't have any kind of voice or choice in my healthcare. Things were just done to me. There was no informed consent, no discussions. And it was very eye-opening to see how people who don't have money or education could be treated. And it shouldn't be like that. And so once I got my crap together and figured out, I need to go back to school, I need to get my GED, I need to figure out how to go to college. I did all of that because I wanted to help women. I wanted to be their doctor and have discussions with them and tell them that they had choices in the birth control they used and in their bodies, and things like is labor and delivery, like you have a choice. Do you want to be cut with an episiotomy? Do you want to have an epidural? I mean, little things, they just all added up to a crazy scenario for me that really took away my power. And so, that that whole thing stewed in the back of my mind as I studied and I went to college and I went to medical school, and I just kept thinking, okay, someday I'm going to take care of women. And I did all that. I did the stressful lifestyle. And I'll just tell you that becoming a physician is one of the most unhealthy things you could ever do.
Isn't that crazy?
Yes, it's the epitome of hypocrisy, right? Like, I was so sleep deprived. I was eating the worst food. I was not managing my stress. No self-care whatsoever. I mean, you are praised for neglecting yourself, essentially. You know, if you're not going to the bathroom, you're not eating, you're not sleeping, you get praised for these things, especially if you can do surgery and function under those conditions. And so it's a very malignant situation. And I did that, you know, for a long time. And I went out into the world. I was an obstetrician gynecologist practicing for 10 years. And I thought, okay, is this really it? Because I'm absolutely miserable. I'm falling asleep at my desk. I don't have energy for my children. I'm 20 pounds overweight. Like, it was not satisfying, except that I was, you know, taking care of women. So, and it all came to a head when I had a back injury, and that really put me down. I had to take 4 months off of my life just to fix myself because conventional medicine failed me. They told me I just needed surgery and I would be good to go. Well, that didn't happen. And so when I re-injured 6 weeks post-op, I had to figure out to do a different way. And that's when I found the world of functional medicine. And it was so eye-opening and amazing. And once I started practicing these things on myself, I healed, right? So how could I not embrace this whole new world? So I learned so much about the gut and managing stress and balancing hormones, and all of these things had nothing to do with medications or surgeries. And that was my world for the past 15 years. And so it was very eye-opening. And when I was off for that 4 months, I decided I'm going to write my book. I'm going to tell my life story. So I wrote my book to inspire other women to go do what they want to do, find their purpose. And out of that came a whole new me. I changed my practice. You know, I gave up obstetrics for myself, just so I could heal myself and do what I needed to do. And I think it's really empowering to say, you know what, I can't handle that anymore, or I need to set these boundaries. I need to make this a priority, and that's okay. And, you know, I'm sad that I'm not delivering babies anymore. My patients were sad, but they understood. You have to do what you need to do to survive and thrive, right?
I so agree. And if your cup isn't full, if your cup is half empty, how good are you to anybody? So I think that was for the benefit of everybody. So wonderful what you did. And you're a role model to your patients now, because what you're doing, the work you're doing, is so very important.
Yeah, I love that I can actually say, I've done these things. They work. I've been through it. It's okay to set boundaries. It's okay to say no. It's okay to put yourself first, because honestly, that is the only way to heal and to reclaim your health. And so I think they respect me a lot more now too.
And I think the interesting thing is, from a person who teaches happiness, and I'm so on the same page as you, people think, oh yes, I have to do this, 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 and then I'll reduce my stress, or then I'll take care of myself. And as you pointed out, it's exactly the opposite. It's so important
Yes.
to have a foundation. So that's really great. So what would you say were the biggest differences then by being a functional gynecologist versus a conventional gynecologist? I know you could talk a whole hour on that, but maybe just real briefly in terms of what has changed in your practice from when you first started practicing.
Well, I will say the most eye-opening is just telling you the statistics that I used to do about 4 surgeries every week, and I haven't done a surgery in 8 months, and my patients are still healing because I have so many other tools in my toolbox now. I don't have to take them to the OR right away. So I think that says a lot right there, you know? So I used to rely heavily on birth control pills to balance hormones, right? Or fixed periods, when really it's not doing any of that. But that was the only tool that I had as a conventional gynecologist, was medications or surgery. As a functional gynecologist, I heal your gut through diet. I help you manage your stress, which balances your sex hormones. I work on so many other levels. We do integrative medicine where we're using acupuncture and IV nutrition and sauna detox and just a whole other world of therapies. It's amazing.
Oh, that's just so wonderful. So in your mind, how often do you think a woman should see their gynecologist? Because I know there's controversy now and insurance is changing that. And
Yes, and it depends on who you ask. So when the ASCCP, which stands for the American Society of Colposcopists, came out and said you don't need a pap smear more than every 5 years or every 3 years without an HPV test, everyone took that to mean that you didn't need to go to the gynecologist anymore. I had family practice doctors all over telling patients, yeah, we'll see you in 5 years. We did women such a disservice with that idea, because a pap smear is a test for abnormal cells in your cervix. I promise we're more than our cervix, right? That is one tiny little piece of the puzzle. There are so many more things that you and your gynecologist should be monitoring, evaluating, talking about, that you should see them at least every year for an exam, and more often if you're dealing with anything. So, I typically am the one who is seeing them naked from head to toe, and no other doctor is probably doing that. Unless you already have like an abnormal mole, you probably aren't going to a dermatologist. So I'm doing the initial skin screening. I'm talking to you about things going on in your relationships and how are your hormone levels. And I'm, evaluating vaginal health, vulvar health, your ovaries, your breasts. I mean, so many other things. And if you're going 3 to 5 years between having an exam and having discussions like that, you're missing out on the opportunity to get well, because I promise most of us are not functioning to our optimal level, right?
oh, absolutely. That's such good information, because that did happen where people think, oh, I'll just see my family physician. And now that I don't need the pap smear, I can just forget about the gynecologist. And that absolutely was doing people a disservice. So
Yes.
yes, thank you for bringing that up. And let's go to the bones, because I think you bring an incredible perspective to bone health that is missing. And so when do you think women should start, as a functional gynecologist, when do you think women should start thinking about bone health?
I think we should be thinking about it, as early as we can. I would say that, I was really surprised when the really popular birth control, Depo-Provera, which is a shot you get in your arm every 3 months, they came out with a black box warning saying, oh, this leads to bone loss. And we need to worry about this in our teenagers and 20-somethings who are on Depo-Provera for a long time. And that got about 5 minutes of headline, and then it was kind of swept under the rug. But it really got me thinking, like, when do we need to worry about our bone health? And it's not at 65 when Medicare will pay for a bone density exam. It is, when you are still building bone. So you're building bone up until your late teens, maybe even 20. And then you're kind of in this steady state of bone remodeling, reabsorption. So it's a cycle where you're turning bone over and keeping it healthy. But once you hit about 40, you don't do that anymore. And so the damage is kind of done at that point. If you've been on certain medications that thin your bones, if you haven't been, regularly exercising or have had poor nutrition, like the standard American diet, right? So we get into this place where we often neglect our bone health, and then menopause comes and we start, decreasing how much estrogen we're producing, and that compounds the issue. And then we're questioning, well, why do I have osteopenia? Why do I have osteoporosis? How did this happen? And I would really love for us to get to a point where we're having a regular conversation. How do I prevent that? How do I prevent that from occurring?
Oh, this is making me so happy because, as you know, that's how I feel. And I feel everybody, pediatricians, every gynecologist, not the functional gynecologist, everybody needs to deal with bone health at every age, because if we do things early on, I believe we could make such a huge dent and really significantly reduce, if even eliminate osteoporosis if early on people. So you must be seeing, it's interesting because you're doing that. You're affecting this at every age and in every spot. That's wonderful.
Yeah, I mean, I work in a predominantly Caucasian area. I wish I didn't, but that's kind of, the area I live in. And Caucasian women have a much higher proportion of bone thinning. And I also have a population that tends to drink more alcohol and socialize and party more, or use it as stress relief. And alcohol, more than one drink, two drinks every night on a regular basis, that can lead to bone loss, bone thinning. I also see a lot of PPI use. So proton-pump inhibitors are medications for heartburn. And I see so many women on those, and they are on them for years before their doctor even thinks about taking them off. And that's where you start not absorbing your vitamins and nutrients, and that can contribute to it as well. So there's a lot of, common medications out there that are just being seen as, oh, they're not so harmful, but really they are contributing to the problem. So I think it's important for women to have a discussion with their doctor, like, hey, what do you think about my risk of bone loss? Do you see any flags here that I should be thinking about, worrying about, doing something differently? Should I be in Margie's Happy Bones program, worrying about my posture, that type of thing? Like, I know there's stuff that we all can do for sure.
Oh, that's great, because you just want, again, that typically, just exactly what you said. The ACOG, the American College of Gynecologists, really says 65 is when you get your first, unless there's risk factors. So often, I think the majority of people don't even think about their bones. They think it's an older person's disease, and it's called a disease. I don't like to even call it a disease, because I think it's a condition, and it's something that that doesn't happen until you're over 65, which is so far from the truth. And when we take care of our bones, and when you're working with people from a young age, there's so much that they can do. So I think that's really great. And I also love, I meant to say this early on, a voice and a choice. Those were great words that you said, because I think that's what you do with your patients, give them a voice and a choice. And everybody should have that. There's no reason why they don't in their own medical care. So.
Yeah, I think the time of being a paternalistic physician is over. You can't just go to the doctor and be told, here's what's best for you, because what we're seeing is that science is antiquated, and what physicians are doing has already been shown to be proven incorrect or outdated, and it's really hard to keep up with the science as a typical physician. And so I think it's important for patients to ask questions, and if they're not comfortable with the plan that's being laid out for them, don't be afraid to use your voice and say, why are we doing this? Why do you recommend this? And hold them accountable, because maybe it's time for them to look at the research again and see what new is out there. I mean, I myself remember the first time a patient asked me about adrenal fatigue, and she was like, what do you think about that? Is that real? And I looked at her and I said, honestly, I've never heard of that. I don't know what you're talking about. And when I went and searched it and, looked at it, there was overwhelming evidence all over the place for, your brain stopping talking to your adrenal glands, your cortisol production going down. Yet I had no idea because it's not standard of care, which doesn't change very often. Standard of care stays standard of care. You know, new things do not get integrated quickly. So I just think it's super important for physicians to be lifelong learners and to keep asking and to be seeking new knowledge. And I think it's super important for patients to push them a little bit to be doing so. And I love podcasts like this because I think it helps patients and people say, well, what do I ask? What should I ask? You know, and so now they can go to their doctor and they can say, does it really matter what kind of exercise I'm doing? Does my diet really matter? And hopefully they'll get the answers that they need.
That's so important because, you know, oftentimes I believe in digging deeper. And if you're not satisfied or you have a condition that doesn't seem to be resolving, you just need to keep asking and keep going. So I love what you're saying. But let's get back to estrogen because when we're younger, yes, the exercise, the diet is critical, and issues, just like you said, people are at young ages, people are put on those proton pump inhibitors. And there's so many other ways that they can deal with gut issues. So going, as you said, going and dealing with that is critical. But let's go, what happens? All right, so now menopause comes and now people are losing estrogen or not having the same menopause. So why don't you take us on that scenario? Why is that linked to bone loss?
Yeah, so estrogen, there's actually estrogen receptors in our bones. So estrogen helps mediate what's called osteoclasts. Those are the cells that turn over and make new bones. And they also inhibit, I said that backwards. I apologize. Osteoblasts, those are the ones that form new bone, where osteoclasts break down bone. And you want to have a balance of that situation. And so when you don't have estrogen binding to those receptors and stimulating osteoblast formation, you're not going to get the new bone turnover, and you might get, too much resorption of bone. And so you end up with bone thinning or bone loss, osteopenia. So the biggest decrease in bone density that we see is usually about 5 to 8 years after menopause. So during that transition of losing estrogen is the key time where you're going to lose that bone density. So I love having my women do strength training, weight training, that type of thing to try to counteract that, right? And then we also have issues of premature menopause. I'm seeing this more and more now with women going through menopause before the age of 45. Sometimes it's due to chronic stress. Sometimes it's surgical induced. Conventional gynecologists will take out your ovaries for endometriosis, ovarian cysts, things like that. Or if you have an endometrial ablation for heavy periods, sometimes that affects the blood flow to the ovaries and you get earlier menopause. So when that happens, your estrogen levels are going to go down and you're not going to have that bone activity going on like you used to. So it's super important to know that, number one, you got to prevent your bones from being thin in the first place. And then you got to be ready to counteract that when you go through menopause. You want to be physically active and eating well and have a healthy gut and all those things for happy bones, right?
Oh, you and I are so on the same page. I'm just sitting here like, every single thing you're saying. Yes. It's so nice. I wish you lived right around the corner. I would. It's just so wonderful to work with practitioners like yourself who look at it from that perspective. So
yes,
yeah,
for sure.
So that's great. And so what other symptoms then when people are estrogen deficient? What other symptoms do you see?
So oftentimes I like to use those as a conversation going into bone health. The first thing I notice is people will come to me complaining of vaginal issues. They have recurrent bacterial vaginosis or yeast because all of a sudden when you lack estrogen, your pH balance changes in that vaginal tissue. And so the health of that can be compromised. There's actually a microbiome in your vagina. There's bacteria that are supposed to be living in there imbalanced, and those get changed. And so a lot of women will come to me, with these vaginal complaints or dry, painful intercourse, things like that, or just feeling like they have a bladder infection, or they could get a bladder infection more easily because of it. And so, I use that as this time to say, this is due to lack of estrogen. And so this is, your whole body has estrogen receptors, and you might not be noticing it, but this is happening in your bones as well. So it's a good way to start a conversation, because I don't know about you, but I hear a lot of women who are looking forward to menopause, and they're like, oh yeah, I just want to be done with that crazy period. I just want to be in menopause. I'm like, well, here we go. We're going to deal with some vaginal issues and some bone issues, and your skin's going to get thinner. You might have thinning hair, coarser hair, things like that. So those symptoms come before the bone loss symptoms, right? Usually you don't even know you have a bone issue until you have a fragility fracture, which means like you break something just from falling standing height or any other, way that someone else would not break a bone. And it's super common right after menopause for that to happen. But I think if we start to realize, hey, I'm having skin changes, my vaginal health is different, my eyesight, things like that, it doesn't necessarily mean you have to go and take estrogen. That's the new popular thing is, oh, I better get on some estrogen therapy. Some women need that or want that. That's fine. But your body is making a little bit of estrogen still if you have your ovaries. It's just not making enough to be able to reproduce and create a human, right? So you're still making a little bit of estrogen and testosterone that should protect your bones, but you do need to do those other factors like exercising and eating well to add to it.
And in your practice then, because I think, you can share what you've seen. So when people who aren't eating well, they're not exercising, and they're not dealing with their stress. And it sounds like that's those are your first go-tos. What have you seen when they put those three things in place in terms of the hormones and just in general without going on the estrogen? What have you seen?
Oh, I see amazing results. What I try to explain to people is your sex hormones, estrogen, testosterone, progesterone, they're kind of downstream. They're more like innocent bystanders. They get the result of whatever's happening upstream with your cortisol and your insulin and your thyroid, the big players. And so if you have everything else on par, then your hormones are going to be fine. If you are crazy stressed and your cortisol production is out of whack, you have, either a flipped cortisol pattern or a flattened cortisol pattern, then your sex hormones are going to be affected. But if you have your stress under control, your energy level's good, you're sleeping well, and your insulin production is normal, you're not, that's a whole nother discussion. If all those things are balanced, then you don't have to worry about your estrogen and your testosterone and such. Of course, there's outlying women who do. So I don't want to say everybody should be like this. Nobody needs hormone replacement therapy, because that's not the truth. There are some women. There's a lot of women who've had their ovaries removed, at the age of 39 for endometriosis, things like that. So there's all kinds of outliers, but I just want women to realize that is not going to be the game changer. A lot of times I see people just doing bioidentical hormones and thinking that's enough when they're still eating the standard American diet, they're still having a sedentary lifestyle, or they're still smoking or drinking too much, taking their PPIs. And those sex hormones are not going to help because they are just so far downstream. They're not the end all be all, honestly.
I think that's so important, because That's the mindset. And I don't fault people because that's what we've grown up with. You go to
Yeah.
the doctor, and I'm sure as trained as a conventional medicine doctor, you go to the doctor, this is bothering you, or you have a vaginal itch, you can get some cream that fix that, or you have this, let's give you the pill. So, oh, your estrogen's down, let's give you estrogen. And not to think that all these other things you need, or the groundwork that you need, regardless of what you end up doing, it really should be done first, and then you may not even need anything. That's what's so, because as you said, the sex hormones change. So I really love that approach and think that's a great way to look at things. In terms of testing, what maybe test would you do that a conventional practitioner wouldn't do at any age, at menopause? Or is there certain things people should ask for that would be really helpful, do you think?
Well, I definitely like to look at trends as a functional gynecologist. I love to see where your fasting sugar and insulin are, because I think that's super important for systemic inflammation and overall health and gut health. So say we do a hemoglobin A1C, that's a marker of what your blood sugar has been for the past 3 months. And then we do it again in 3 months or 6 months. And I can see a trend. Is it going up or is it going down? And I think that's really important because it helps keep people on track when they're trying to make changes and improvements in their life. So where I think conventional medicine goes wrong is that they don't look at trends. They look at one specific lab value and they say, yes, you have this disease, diabetes. No, you don't have diabetes. We'll see you in a year. And there's no discussion of what's going to happen over that next year, right? They just keep waiting until you develop the disease, and then they say, here's the medicine. And so I love to look at trends. I love to look at a comprehensive panel of what is your thyroid doing? What's your immune system doing? Is it attacking your thyroid? What's your sugar and cortisol doing? What are your sex hormones doing? Knowing that those change every day for women, right? So it depends on where in the month you're checking these types of things. But as far as bone health, we want to make sure we're getting enough protein in our diet. That's super important. We want to have, strong muscles to support our bones. We can do a urinary telepeptide test that shows us increased bone turnover. So if that number is really high, that's concerning that, hey, maybe your bones are starting to thin. There's a lot of turning over going on in that. And so that is not a standard of care test, but it is in the literature. It has been studied significantly. And what we do know is that if that number is up, that we need to investigate a little further or really focus on preventing osteoporosis. So that's something that you can do at a younger age. They recommend the bone density scan, like you said, at 65, unless you have risk factors. I will tell you, insurance will fight you to the death. They don't want to pay for that test. I do it all the time. I constantly get fights from the insurance companies. I'm like, well, she's a smoker. Her BMI is 16, meaning she's super underweight. She's alcoholic or whatever. Like, they have obvious risk factors and insurance still doesn't want to pay. So don't be surprised if that's an issue. I would say, have a conversation with your doctor, see what your risk factors are. You can also do the FRAX tool testing, which checks off all your risk factors and gives you a score to see what your risk is and if you should be looking into more. So there's definitely things that can be evaluated with you as an individual, and that's what I think is super key. Like, it's all based on the individual. There's no standards. And I will mention that the DEXA scan, we hang our hat on it, and everybody recommends it. The World Health Organization, everything. But the testing parameters, like the results, are based on young, healthy white women. And so we use this standard deviation to determine how far off are you from this young, healthy white woman, and this is your risk factor. I think that is super flawed, and we're missing a huge population of people, but that's what we're using to determine whether we give them medications and treatments or not. So I think we have a lot of research yet to do in the world of bone health, and we're really just scratching the surface with all of it.
Oh, so true, because people, as you said, people don't know. Osteoporosis is completely silent. You don't have any symptoms, unlike other things. If you have blood sugar issues, you may start noticing, or diabetes, or really most things. It's one of the few conditions that you really don't know about. And a person who feels good can get a bone density test, and all of a sudden they feel their life has changed. They're like, oh my God, I have the bones, because it's standard deviations from a 30-year-old. So, and the other thing, it doesn't measure quality. So two people with the same bone density can have very different bone qualities. And I think that's what's good about the trabecular bone scoring that's just coming into play now. And I know that's not covered at all, I don't think, by insurance, but I think people are realizing that quality, bone density isn't enough. And I think that's great that you mentioned, looking at the telepeptides and looking at other tests to look at bone turnover. But you're right. And so people are then freaked out. Cortisol is through the roof. And they've just, by having this test, it's now gotten them, absolutely in a frenzy. But I look at it as, okay, it's almost a time like a reset. Okay, you got this information. Rarely are the bones in isolation. So if something's going on, they have the opportunity then to look and see. And indeed, they'll probably be so much healthier. They'll really look at the underlying issues of everything. And in the end, it ends up being a blessing. But have you seen that as well?
Oh yeah, for sure. I just like to use that as a conversation starter. Like, hey, this is what we need to do. We need to get focused on you. We need to change up some things, prioritize, right? And I think it's a time for growth and an opportunity, like you said.
And so for the cortisol, is there something that you use to measure the cortisols, or anything in particular, or do you just work on people's stress and then things get better?
Well, I particularly like doing it through the Dutch company, which stands for Dried Urine Testing for Comprehensive Hormones. They do a saliva test where you can do it 4 times or 5 times if you want to see your awakening response. And they will chart it on a graph to see what your cortisol pattern is throughout the day. And then they can also check your cortisol metabolites in your urine, which solidifies the validity of the test. So I really appreciate how they lay it out with the cortisol pattern, because it's good to have a visual representation of what women are feeling. So if they look at this pattern and they see that their cortisol is way off, the charts where it shouldn't be, it clicks to them. Oh, this stress really isn't normal. I am having an abnormal response to it. Or if they're flatlined, it validates the fact that they don't want to get out of bed in the morning. They can't function at all during the day. I'm like, it's not all in your head. Like, literally, here you are, you're flatlined. So I just like the visual of that. And I think it's really helpful to get patients moving in the right direction. They're like, okay, what do I got to do to fix this? And then you retest it in 6 or 12 months and you can get back into a normal pattern. That is really satisfying and I think motivating.
That's great, because it does, I like the Dutch test as well. And it does legitimize, what you're saying, how the cortisol has such an impact on every area of their health. And then they can see the improvement. Because you're right, when people see it on a graph or see it on paper, it translates in, and they take action. People, just like when people find out, I've seen so much that the blood sugar, like you mentioned earlier, people as they get older are starting to have pre-diabetes, or will say on the, they start having increases in their blood sugar. And sometimes they just look at the one value as you mentioned also. And that's not accurate, because that can change versus, what you had the night before. But the A1C was such a good point. But anyway, back to what we were saying, that, that's so important, the cortisol. And that's what I've seen. I just see that for year after year, that when you deal with that piece, and I saw that early on as a physical therapist too, not testing, not doing anything, but if we just had, someone had a muscle injury or a back injury, if we just dealt with that and not the underlying stress, and it didn't stay better. So it was,
Yes.
it was so, so very important. So what would you tell all the women? I know I could talk to you for hours, because you are so full of information, and I truly, truly adore the way you approach things. And I just think the way I just think everything's great about you, how you started what you're doing and how you're helping so many people. And that has to be very rewarding to you, because you see them on a continuum. So it's not that you're just helping them at one point. You see them in their 30s and 40s, and you can work with people. And so that when you see them, your 90-year-olds, those people are going to be in such good shape. But anyway, so if you wanted to leave a few things and best things for people to focus on to reclaim their health, what would you say? If you had to give some tips to everybody listening, what things they could start on right away to help, just to help reclaim their health.
I really do think that the last thing we talked about was the most important, just the stress, managing our cortisol production. And so because we're all so busy, we all have our plates full, we're all going 110 miles an hour from dusk till dawn, doesn't mean that it's normal or healthy, right? Just because we're all doing it doesn't make it okay. It just makes it common, but it doesn't make it healthy or normal. So I would love for women to really stop and evaluate how they're living their life. What is your purpose? What's your why? Like, get into that higher power issue. Like, why am I here? I know it's hard for women because they get stuck in this survival mode. They're just trying to feed their kids and get them to soccer practice and do their job and buy the groceries. And you all of a sudden forget who you are, why you're here, because I think we all have a purpose to make a bigger impact. But if we are not managing what's happening around us and to us, and we're just like living in this whirlwind of a moment in survival mode, we're not going to fulfill our purpose. We're not going to, it's not going to come to fruition. And that's really sad. Like, we all have a purpose. We need to figure that out and work toward it, because I think you're going to be so much happier and healthier if you are driving toward your purpose. Once I got clarity on, I'm not supposed to just be like cramming patients through every 15 minutes and cutting on people and going on to the next one. That's how it felt. It felt crazy. And once I realized, wait a second, they need a voice. They need me to slow down and listen. I need to take care of myself, then teach them how to do the same. Like, when I got that clarity, I didn't only heal myself, but I also helped my children, I helped my husband, and I helped my patients. So I think that is the bigger thing that we need to be doing, is take a breath, like step back. Why are you living this life? Why are you doing the crazy things you're doing all day long? Does it serve your purpose and your plan? And if it doesn't, have some courage to make some changes, right? And seek the guidance of people like you and me, where we can hold your hands and help you through it. Because when you reclaim your health physically, then you can reclaim your health emotionally and mentally. And you're just, sky's the limits.
That was so beautifully said.
Oh.
I'm sitting here just thinking, absolutely. And passion and purpose, once you have that, life flows. You feel like you're riding with the waves, even if they, right now we're in a tough situation, and the people that know their passion and their purpose are just so much more resilient, and life is very different. So I think that was such amazing advice. I know that years ago I was very happy, and I was teaching relaxation to people, but I wasn't practicing it myself. I was shoving food in the car while I was going somewhere to the next patient. And it hit me because I signed up for an 8-week meditation class, mindfulness meditation, and I got a speeding ticket on the way to meditation. That was the best thing ever. It hit me in the head that you are absolutely not practicing what you preach. And I just had to. I took that class as though it was the most important thing. And I just also realized that I had to slow down, that even though I was happy, I was still stressed. And once I started doing practices and changing my life, oh my goodness, it's been 12 years since I've added that piece, at least, to every single thing I'm doing. But you're so right. And I think coming from a gynecologist, a physician, to tell people that this is what they need to start with, I think is really, really very powerful. And I'm just so glad that you've been on. But you have some great things. I love the ebook that people can get. So how can people get your ebook?
Yeah, so if you go to my website, drtabatha.com, it's 3 A's, no I's. There's a link on there, the Functional Gynecologist Guide to Balancing Your Hormones. And you can get that PDF downloaded for free. It's a great little guide to get you started.
It really is good. You go into the liver. You go into, it's not like you just say little things. You really explain. I think it's wonderful, actually.
Thank you.
It'll really give you a deeper understanding of some of the concepts we touched on today. So I really liked it. I thought it was great. I mean, I think it's great. And so if people want to stay in touch with you, use your website. What's the best way?
Please follow me on Instagram. That's where I spend most of my time, or on Facebook at Dr. Tabatha. And if you want to shoot me questions, just DM me. I would love to hear from people. They can check out my podcast, The Functional Gynecologist, where Margie's been an awesome guest. That was a great episode as well. So, yeah.
Oh, that's great. Do you see people virtually?
So right now, the Michigan laws determine, as a physician, I have to see you in the office first before I can see you virtually after that for follow-up. I know that some of the laws have changed with COVID, so I'm, hoping to go more virtual soon, but yeah, or they can come see me one-on-one in my office. Yeah.
So if someone lives in Michigan, are you allowed to see them virtually, or they still have to come
Yes.
to your office? Oh, okay. So
as of COVID, I can see them as a new patient virtually. So that's pretty awesome.
Got it. Oh, great. Well, I cannot thank you enough. As I said, I so enjoy speaking with you and just hearing your whole perspective on this. And I know that we'll stay in touch. So
yes, definitely.
Thank you so much for joining the community today.
Thanks, hon.
I hope you've enjoyed today's interview with Dr. Tabatha as much as I have, and now have some new information to help your bones and overall health. The links to Dr. Tabatha's ebook on balancing hormones, as well as her website, will be in the show notes. So bye for now, and I look forward to seeing you on the next episode.